The news day continues here on One News Now. I'm Riza Diaz. Okta research says a COVID-19 positivity rate may breach 50% in the coming days. According to Okta research professor Guido David, the positivity rate in the metro is already at 50% with a high likelihood of exceeding that in the next few days. Aside from NCR, though, Okta is also seeing an increase in COVID-19 cases around the country, with Calabarzon and Central Luzon closely following NCR. Meanwhile, as cases continue to surge, Health Secretary Francisco Duque III has already announced that his department is preparing for a possible shift to tighter restrictions. The number of areas under granular lockdown in Metro Manila has climbed to 53. This is higher by 140%, with just 22 areas under lockdown last Thursday. 36 of the lockdown areas are located in Manila, 16 are from northern NCR, while one is in southern Manila. Meanwhile, Marikina City will again require the use of face shields in public places, transportation, and vaccination centers as cases increase in the area. Now, one health expert says those who are asymptomatic or with mild COVID symptoms may resort to teleconsultation. Speaking to 1PH, sa totoo lang, Private Hospitals Association of the Philippines President Dr. Jose de Gralo said that currently hospital beds for COVID patients are limited and that admission rates are still largely dependent on the number of healthcare workers. For now, he said teleconsultations is enough for patients with mild symptoms or asymptomatic.
Kung ang mga may symptoms po sila, ng mga mild symptoms o asymptomatic naman po na talaga pong na alam nila more or less o kaya nakapagpa-test na sila at positive. Ngayon na hindi naman po masama yung kanilang mga sintomas, pwede naman po silang mag-teleconsult. And then pagkatapos po ng teleconsultation, meron po mga ibang hospital tinatawag na home care. Makikipag-usap sila through teleconsultation sa mga doktor natin, and then bibigyan sila ng payo kung anong dapat nilang gawin.
The Philippine Red Cross is looking at lowering the cost of RT-PCR testing as COVID-19 cases surge. In an interview with the Chiefs, PRC chairperson and Senator Richard Gordon said they're mulling lowering the cost of RT-PCR tests, which currently cost 2,800 pesos. Despite higher demand in testing, Gordon assures the public that the PRC has enough testing kits.
Well stocked up. Inaabangan natin yung Chinese New Year, so nag-stock up kami. Pero humihingi na rin yung iba mga kasama natin sa IATF na mga test kits at yung ibang mga agencies humihingi rin sa amin, nangihiram sa amin. And we're willing to do that hanggat kaya.
2 years into the pandemic, the special risk allowances of healthcare workers in the front lines remain measly. Marian Enriquez with the story.
Despite risking their lives during the pandemic, healthcare workers are dismayed over the meager special risk allowances they received. Among them is Dr. Beng Rivera Reyes in Camarines Sur, who only got around 2,000 pesos worth of SRA in her 6 months of duty. Some of her colleagues only received 300 to 600 pesos. Others received none. Dr. Beng said the amount of SRA they received may have been computed based on the days that they were exposed to COVID-positive patients and not for the whole duration of their duty. Medical frontliners have time and again appealed that all of them should receive special risk allowances. But for now, they're only entitled to a 5,000 peso SRA. Even the president himself finds this amount too measly.
They should be given more. You take into account the possibility of danger. They themselves will get because of they have to go near and they have to treat those people. I will increase, hindi ko pa masabi magkano.
But the Filipino Nurses United notes that most healthcare workers do not receive any benefits.
Marami pa rin sa aming mga kasamahan ang hindi nakakatanggap o kulang ang natatanggap. Kung kaya't last quarter of last year, di ba, kinalampag namin ang Department of Health.
Another problem is that more and more medical workers are getting sick.
Almost mga 30 to 50% ang nababawas sa manpower nila sa ospital. Kaya ang isa sa mga panawagan ng ating mga nurses ay magkaroon ng augmentation o pagdagdag.
For his part, Health Secretary Francisco Duque III assures health workers that hospitals from other regions can augment the much-needed manpower in Metro Manila. For News 5, Marian Enriquez, we are One News.
Many countries are overwhelmed with the number of cases brought by the spread of the Omicron variant. Now, despite this, the World Health Organization insists that the new variant is less severe than previous ones. Let's watch this.
So Omicron, the latest variant of concern the WHO is tracking, has been detected around the world. It is efficiently transmitting, and in fact, everywhere where we have good sequencing, this variant is being detected. So it is circulating globally at the present time. What we are seeing is a very sharp increase in case numbers. You will have noticed in the latest WHO update, almost 10 million cases reported in the last 7 days. And that's the highest number of cases we've seen to date. In the last 24 hours, it's been almost 2.5 million cases, or more than 2.5 million cases. So there are several reasons why we're seeing such a sharp increase in case numbers. First is the emergence of Omicron and the circulation of Omicron, which transmits very efficiently between people. There's a number of reasons for this. First is the mutations that it has. The virus is able to adhere to human cells more easily. It has mutations that allow it to do that. Second is that we have what is called immune escape. And this means that people can be reinfected, either from if they had a previous infection or if they've been vaccinated. Now you have to remember, vaccines are incredibly effective at preventing severe disease and death, but they don't prevent all infections and they don't prevent all onward transmission. So it is still absolutely critical to get vaccinated because it will save your life, but it doesn't prevent all infections or transmission. With regards to the severity of Omicron, we're learning more about this every day. What we understand from a number of countries and the studies that are coming from a number of countries is that your risk of developing severe disease or needing hospitalization from Omicron is less compared to Delta. That doesn't mean that it's a mild disease. It does mean, though, that if you are infected, that your chances of needing hospitalization are less. What we do know also from a number of countries is that your risk of developing severe disease increases with age, and that's the same as with Delta. It also increases if you have underlying conditions, and of course, it's increased if you're not vaccinated. So this is why it is so critical that when it is your turn, that you get vaccinated, that you receive the full dose, because vaccination is saving lives. Vaccination is preventing people from developing severe disease as well as going on to dying, and that's true for Delta as well as for Omicron.
And those are the top stories of the hour. Join us later again at 2 in the afternoon as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.